organization that's been in business for a number of years, and we have partnered with carriers across the US to ensure that members get a in-home evaluation. That in-home evaluation helps them understand what are the challenges that our members see day in and day out. Our members can range from everybody from an ACA plan to a commercial plan to an MA plan. And so what we're able to do is we are able to Signify Health, once again, collaborates with those carrier partners, and there's over 50 of them that we collaborate with. And what we're able to do is we go into the home and do a comprehensive assessment. So today, and I'm going to actually go off screen because I'm sitting here looking at myself, and that's never any fun. And that way we can really hyper focus in on this slide, and I'm going to actually increase it a little bit more. This is one of our broker fact sheets. And this goes through, once again, what is an in-home evaluation? We are able to do this across all of the United States and all 50 states. So looking at every zip code that we all serve, and we have over 12,000 clinicians. Those clinicians are typically a nurse practitioner, physician's assistant, a DO, and even MDs that work for us here at Signify Health. And once again, we go into the home and see your clients. Today, we're supporting over 50 different health plans, once again, ranging from commercial, ACA, Medicare Advantage. So when we think about what is an in-home evaluation, it is that licensed clinician that is going in and they are trying to uncover needs that our members may have. They typically will spend about an hour with that member. And why this is important is this is at zero cost to the member. The health plan is paying for this in-home evaluation. Once again, nurse practitioner, physician assistant, DO or MD, going into the home setting and capturing all of that information. They're going in there and it's almost like that concierge service type. Clinicians going in there, they are walking up their steps, making sure that they are listening and engaging with that member. And so I always tell people, I really love for you to kind of visualize what that experience is like. They go in, they ask them, tell us where you want to sit. Do we want to sit in your living room? Do we want to sit in the kitchen? Wherever the member is most comfortable. And they're going to have a conversation, but also a comprehensive exam. So we can take blood at these visits. So if a member needs to have their blood drawn, we can absolutely do that. We'll also ask a lot of questions in regards if they have any chronic conditions. So if potentially they're a diabetic, we're going to walk through how they take, when they do their finger sticks every day, what foods they eat. And also we're going to actually ask the member what type of questions they might have. This is a time for the member to truly engage with that professional, that clinical professional, to ask lots of questions. If they don't understand something about their health conditions, or if they're concerned about something, it's a great time for them to have someone in their home. One of the other things I always love to bring forward is if you have a member who would like to have a loved one join them, we absolutely love that. We want members to feel confident and also share in the opportunity to have a loved one sit with them. So if they have a husband, a wife has a husband and she wants them to join her on this comprehensive visit, absolutely. Once again, it's in their home. So one of the things that we love about these visits and having the opportunity to have you as the agent who, these are once again your clients, engage, is that you are able to then connect your member to this highly concierge opportunity. And so when you think about that stickiness with a member to you, It's important because once again, you're offering them this opportunity to have somebody come into their home and have this comprehensive exam. During this exam, we're going to capture about anywhere from 300 to 350 different data points. Everything from, once again, how is their hearing? We're going to go through their medical, we're going to go through their medications. So when are they taking their medications? Are they taking it correctly? People will share with us if they have any food or housing insecurities during these calls. And we may be able to once again help do case management referrals as well. We'll see if there's any fall risk screenings that we need to do, and also lots of different behavioral health screenings. So think about depression screenings. We do a lot of those. And so we're able to once again collect those labs if needed, so that blood draw. And once again, any other diagnostic tests that might be necessary. We also know that so many of the members that we see will go ahead and ask us, will you come back next year? And we do. We'll be able to, if they're eligible for that visit, come back the following year. So today, how Signify engages with members is that we are calling your members every single day. We actually schedule about 34,000 members every day from our call centers. So I want you to think about that. Signify Health calls on behalf of the health plan. So I'm going to just kind of walk you through that. So I would call your member, your client, and I would say, hi, this is Jill. I'm calling on behalf of Aetna to schedule your healthy home visit. Now, one of three things is